Hello and welcome. Today, we'll be exploring schizophrenia, a complex and often misunderstood brain disorder that affects millions worldwide. We'll delve into what it is, what might cause it, how it's diagnosed, and what treatments are available. The exact cause of schizophrenia remains elusive, but it's generally accepted that a combination of genetic predisposition and environmental factors play a crucial role. Research suggests that individuals with a family history of schizophrenia are at a higher risk. Environmental triggers, such as prenatal exposure to viral infections, complications during birth, and psychosocial stressors during critical developmental periods, are also believed to contribute to its onset. Schizophrenia is associated with significant alterations in brain structure and function. Neurotransmitters, particularly dopamine and glutamate, are thought to be imbalanced, leading to disruptions in brain circuitry. Studies using brain imaging techniques like MRI and PET scans have revealed differences in brain volume, particularly in the prefrontal cortex, hippocampus, and amygdala. These areas are crucial for cognitive functions, emotional processing, and memory, explaining many of the symptoms experienced by individuals with schizophrenia. Moreover, impaired connectivity between different brain regions further contributes to the disorganized thinking and perceptual disturbances characteristic of the disorder. Schizophrenia affects approximately 1% of the global population, impacting men and women nearly equally. Symptoms typically emerge in late adolescence or early adulthood, often between the ages of 16 and 30, while the prevalence is consistent across different cultures. The course and expression of the illness can vary considerably. Understanding the epidemiology of schizophrenia is essential for developing targeted prevention and intervention strategies. The signs and symptoms of schizophrenia can be categorized into three main groups: positive, negative, and cognitive. Positive symptoms include hallucinations, which are sensory experiences that occur without any external stimulus, such as hearing voices or seeing things that aren't there. Delusions are fixed, false beliefs that are not based in reality. Disorganized thinking and speech, such as incoherent speech or rapidly shifting topics, are also common. Negative symptoms involve a reduction or absence of normal functions, such as flat affect, a reduced emotional expression, alogia, poverty of speech, avolition, a lack of motivation, and anhedonia, an ability to experience pleasure. Cognitive symptoms include difficulties with attention, memory, and executive functions, such as planning and problem solving. These cognitive impairments can significantly impact daily functioning and quality of life. Diagnosing schizophrenia involves a comprehensive evaluation, including a thorough medical history, physical examination, and psychological assessment. There are no specific lab tests or brain scans that can definitively diagnose schizophrenia. Instead, healthcare professionals rely on diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. To meet the criteria for schizophrenia, an individual must experience two or more characteristic symptoms, such as delusions, hallucinations, or disorganized speech, for a significant portion of time during a 1-month period. These symptoms must cause significant impairment in social, occupational, or self-care functioning. It's also important to rule out other conditions that may mimic schizophrenia, such as substance use disorders or other mental health disorders. While the term types of schizophrenia is less emphasized now, historically it was categorized into subtypes like paranoid, disorganized, catatonic, undifferentiated, and residual. However, the current edition no longer uses these subtypes. Instead, it focuses on dimensional assessments of symptom severity to provide a more nuanced and individualized approach to diagnosis and treatment. Treatment for schizophrenia typically involves a combination of medication, psychotherapy, and psychosocial support. Antipsychotic medications are the cornerstone of treatment, helping to reduce the severity of positive symptoms such as hallucinations and delusions. Newer, atypical antipsychotics are often preferred due to their lower risk of side effects compared to older, typical antipsychotics. Psychotherapy, such as cognitive behavioral therapy or CBT, can help individuals develop coping skills, manage their symptoms, and improve their overall functioning. Psychosocial interventions, such as supported employment, social skills training, and family therapy, are also crucial for promoting recovery and improving quality of life. Assertive community treatments (ACT) is also a very important method of treatment in the U.S. It's a team-based approach to providing treatment in the community setting. Currently, there are no definitive ways to prevent schizophrenia. However, early identification and intervention may improve outcomes. Reducing exposure to known risk factors, such as prenatal infections and substance abuse during adolescence, may also help. Promoting mental health awareness and reducing stigma associated with mental illness can encourage individuals to seek help early, which can potentially mitigate the severity of the disorder. The prognosis for schizophrenia varies considerably depending on individual factors such as the severity of symptoms, the age of onset, the presence of co-occurring conditions, and adherence to treatment. While some individuals experience chronic and debilitating symptoms, others achieve significant remission and lead fulfilling lives. Ongoing research is focused on identifying biomarkers, developing novel treatments, and improving our understanding of the underlying mechanisms of schizophrenia. Recent advances include the development of long-acting injectable antipsychotics, which can improve adherence to medication regimens, and the exploration of novel therapeutic targets, such as glutamate receptors and inflammatory pathways. The future holds promise for more effective and personalized treatments for individuals living with schizophrenia.